Hey Heidi, Dr. Kave here, and I'm really excited to do this live for you with an ultrasound here to answer the questions that you guys have about the secrets about your body. I said I would share 3 things you probably didn't know about your body, and I'm going to show you on my body what those things are. I have a left support monitor behind me, I got an ultrasound, and yeah, we're in an operating room, like a real life operating room with the lights, the operating room table, and hopefully your favorite anesthesiologist. So let's get started here. As people are trickling in, this is an ultrasound. All right, I use this almost every day, either the one on my phone or this kind of old school machine for things like IVs, for nerve blocks, and to do echocardiograms on patients before, during, or after surgery, like I just did a couple of minutes ago. So let me show you how I do that. And for those of you guys who are wondering, this is the white stuff, just to show well, we'll get to this for number 3 about things you don't know about your body. But this is one of the anesthetics I use in patients that have a lot of nausea, like what I use today. So anesthesia isn't all just about breathing in gas through the mask and the ventilator. It's also some other cool medications, but we'll talk about those in just a little bit. People are coming in. I love it. Sailboat RN. Hey. You're saying good morning. It's nighttime where I am in the San Francisco Bay Area. I wonder what part of the world you're at. Okay, no more dilly-dallying. The ultrasound, like I promised, guys. What I do is I like to not expose my skin to the surface of this like $7,000 probe. So I always put a cheap little barrier, this plastic. I don't own any stock in Tegaderm, but it is the brand that I tend to use. I cover up the tip. I'm very careful to not have any bubbles. All right, so I super carefully put this, can you guys see this? I wrap it on like that to make sure there are no bubbles, because bubbles here are gonna mess up my ultrasound view and you won't see anything. All right, then I got the ultrasound goop and put it on. All right, there we go. You saw the screen light up, right? That's because now there's a fluid medium that ultrasound can travel through to make a signal on here. So I'll show the easiest one. Patients come in all the time saying, doctor, no one can get my veins, I'm a difficult stick, I'm afraid of having surgery. And I get it, it's tough, right? Because you don't want to be poked multiple times with any needle. This one's one of them. This is a pretty big one, right? I rarely use something this size in an awake patient, but you know, no one wants to be poked no matter how small the needle. So an ultrasound can help us visualize the veins, right? So ultrasound, I'm gonna put it on my arm. I drank a bunch of water for you guys, so hopefully my veins are gonna be very plump. Can everyone see that monitor there? Okay. What you guys are seeing here is a lot of soft tissue, and then you're gonna see a couple black holes. And those, I'm gonna hold my arm down. All right, so I'm just putting my arm down so gravity helps make those holes bigger. And you can see some at the top. I'm pressing down. Can everyone see the ones at the top? Look up here. You see that guy that's opening and closing at the top? That's a big vein. Now, I'll make it easier for you guys to see. I'm going to lower the depth because these are shallow veins. All right. So that vein is at the top there. You guys see that big guy? Can everyone see it? It's at the very top, right there. And as I push down, you can see it collapse. So what do I do to make that vein bigger so I can actually get the IV in there? Very simple. Heidi, I don't want to scare you, but I get a tourniquet, all right? And I wrap it up, and the tourniquet allows the arteries to still send blood into the vein, into the arm, but doesn't let the veins send it out. So now you see the veins have gotten really big. Put the ultrasound back on, and holy guacamole, look how much bigger that same vein has become at the very top of the screen. It's going bouncy, bouncy, bouncy as I press down. Everyone see that? I'm going to freeze the image here. You guys see this here? That. and that, and that. There's a whole bunch of veins. There's a couple arteries here as well. I don't want to poke those. All right. And now I'm going to unfreeze it. So sometimes we need to track the veins as they come up. All right. So anyway, the point is that number one thing you don't know about your body is that we can see all these vessels, and the veins, when we push down, the veins collapse like what you see in the middle of the screen. Now, if I go to the brachial artery, which is here, that guy in the center, you see how there's a, look there, that black hole does not collapse. That's the brachial artery. And that's not what you want to cannulate if you are doing an IV. The one above it here is a vein. It collapses when I press down. Collapse means it gets small. But this one here stays nice and big. And then lastly, what we can do is put something called the color, put this color Doppler on here, and boom. You see which one's the artery? Because that's the one that's pulsating. Does everyone see that pulsating there? That's my brachial artery. If I'm doing an arterial line for whatever reason in the upper arm, that's what I'm going to cannulate, but we don't like to do that because of the risk of blood clots. Not a good place to put a catheter unless you absolutely need to. So the one up there at the top that collapses, that's a vein. The ones that are pulsating there, that's an artery. Okay, very good. I'm going to take the tourniquet off my arm now. I did that one-handed, by the way. That was pretty cool, wasn't it? So that's what you learn. Number one about your body. The veins collapse, the arteries don't. Take color off of this thing. Very good. We use the same concept in the neck as well. So I'm going to bring the mask around. Okay, so look here. This is in my neck. This is my carotid artery. Once again, if I put the color Doppler feature on, look at how it's pulsating there. It's a little bit messy, but you can see the pulsing in the neck. Does everyone see that? Now, look at the one next to it. Look how the one next to it collapses easily. Does everyone see what I'm talking about right here? This guy collapses as I'm pressing on here. So if we're doing a neck vein, that's the vein we're going for, the internal jugular. Maybe you've heard about it before. It's going collapse, collapse, collapse. I can make it very big. This is what sometimes we ask patients to do. We ask them to bear down because maybe you don't know, but when you are lifting weights or you're bearing down, you're causing that vein to get very big. Watch what I do right now. I'm going to do a valsalva maneuver, and you're going to see what happens. 1, 2, 3. Did everyone just see what happened? Did everyone see how instantly how much I changed the blood in that vein? 1, 2, 3. Do you see that there? 1, 2. So that shows just how much you can affect where blood is flowing in your body based on the maneuvers that you have, based on how you breathe, etc. It also has to do with your mindset as well. So I would love to show you connect the monitors to myself, do a little bit of, I guess, secret number 2 you don't know is how you can control your heart. But before I do that, any questions here about the ultrasound? You guys saw some big vessels here. I can show you the thyroid, that's very easy to see as well, or the nerve blocks. You tell me what you want to see before I connect myself to the monitors. This machine probably costs $10,000. My portable ultrasound costs maybe $1,500. Okay, what questions did we miss? Put a cannula into a vein. Not today. All right. Oh, Donna. Hi. Donna, okay, so Donna's mom is having surgery on the carotid artery here. So when people have strokes, we do ultrasounds of the carotid to make sure there isn't plaque inside of them. If this guy has plaque, it shoots them up to your brain, and that can cause a stroke. So carotid endarterectomy, like people are saying there, is when they literally scrape that stuff out. There's always risks because anytime you're scraping plaque out of a vessel, it can shoot up into your brain while you're trying to carve out the plaque. That's why they actually clamp the vessel above to minimize the risk of what we call emboli, or junk in lay terms, from going to your brain to causing a stroke. But the problem is that if you clamp that artery, you also don't let blood flow go, so you might cause a stroke. It can be a risky surgery, which is why we always optimize patients before surgery. If you can't get it AC for a CT with contrast, where would you go next? There's many veins you can do. I actually don't, probably depends on your hospital's protocol, and if they can tolerate a hand vein or a wrist vein. It's usually to time it with the scanner, just so you know. But don't have a more specific answer. I'm so happy that Nakia's grandma just had that surgery. Awesome. And that the outcome was good. All right, so if there aren't any other questions, I promised I would do a little bit of stuff with the monitor here. And I'm going to do it with the ear probe. So I don't know if you guys know, but there's a lot of blood flow all over your body, including your ears. And you can actually monitor patients with ear probes. So let me get myself connected here for you. I'm going to put the ultrasound aside unless you had any other questions. Hey, you guys, by the way, shameless plug, if you're learning stuff here, do hit that like button. Share what you've learned with others, and if you could follow on this YouTube channel, your support helps me do this more often. All right, so, okay, all right. So, this is a real operating room, everybody, and this is what surgery really is like. A lot of tangled cords all the time, a lot of them. So, as I connect myself, very good. Okay, pardon guys. Does everyone see the blood flow in my ears? Can everyone see the blood flow in my ears showing up here? You can see my heartbeat from my earlobe. You can see your heartbeat from your earlobe. Pretty crazy, right? You can also tell my stress level from my earlobe based on how the blood is flowing through it. And I can control my stress level with my mind, and you can see the change on that monitor. There's a number that sometimes we follow in anesthesia. I'm going to show it to you here. There's a cool number on here. Can you guys see this number here? It says 0.13. That shows how relaxed your body is. All right, so what you didn't know, I guess fact number 3 here, is that the more relaxed you are, the more your blood vessels open up. Like the blood vessels I just showed you on the ultrasound. Really cool, right? We can monitor how deep your anesthesia is, because anesthesia relaxes your mind and body, causes your blood vessels to dilate, and we use that as a monitor for how sleepy you are under anesthesia. But you can also control the same things with your mind, even without the anesthesia medications, like the white stuff, the Michael Jackson juice. You don't need this to control how relaxed your mind and body are. So it says 0.18 right now, and this is just based off my ear. I could put this in my nose, on my lips, wherever. I could put the one on my finger if you want as well. But based on how I breathe, you can hear my heart rate variability change. You guys can see my heart rate from my earlobe, and I can actually put it even on the anti-helix there of my ear, and you can still hear my heartbeat. And if I stay in this position long enough, you'll see my PI number here increasing as I enter a more relaxed state. And that relaxed state reflects in your blood vessel tone. One reason why white coat hypertension is so real. Because the more stressed out we get, like when we see somebody with a white coat, our blood vessels constrict. That causes our blood pressure to go up. And that's why so many patients, when they see me, even though I try to be friendly, still have their blood pressure jump through the roof. It's a mind-body connection that has very real consequences. It can cause heart attacks. It's actually a predictor of heart attacks. Bet you didn't know that for fact number 3. So, in the interest of time, we can do a couple Q&As before we peace out for the night. So fact number 1 was just how much control you have over the size of your blood vessels based on the ultrasound and how I cannulate them with veins. I showed you what they look like. Number 2 was how much you can control. I don't know if you heard with my breathing, I was controlling the heart rate variability. And number 3 was how much you can control your level of relaxation to the levels sometimes approaching anesthesia levels with your mind alone. You can do acupuncture to augment that, but the mind can do a lot to get there. And that PI number I showed you with the pulse oximeter, even on my earlobe, showed that. Okay. What number is considered not relaxed? Molly Krause, great question. That number in and of itself doesn't mean anything. It's the trend that we follow. So when I put this on patients, before they fall asleep, I look at what their number is. Then after they fall asleep with medication, I follow to see how high it goes. It goes higher the more relaxed the patient is. So you can probably see it better if I connect it to the traditional finger-based pulse ox. So we'll do that one. Different topic. If I stopped smoking for a couple weeks, asked Lightning McKean, will the anesthesia still be affected during surgery? Smoking, even for a couple of, stopping smoking for about 24 to 48 hours has a big impact in terms of your heart rate and the impact of anesthesia on that. Quitting for 2 weeks allows the mucus production in your lungs to go down, which is optimal. So if you're out of 2 weeks, you're doing fantastic. Right on, keep it up. The anesthesia will be safer, no question about it. If you see on here that PI is 2.6, can you guys see that number? I'm going to bring it closer. And that number in blue says 1.9, 1.8. Now, let me do a couple of 5 and 5 outs. Everyone asks me how I breathe. Well, check it out. With this monitor, you're going to see my heart rate variability change, and you're going to hear it change, and you can see my PI number change as well. Just to show the mind-body connection. All right. 5 in, 5 out breathing is breathing through your belly so that your diaphragm pushes down instead of your chest moving out to activate the vagus nerve. And you're going to hear my heart rate change. I'm going to raise the volume a little bit on here so that you can better hear. Okay. I'm going to do 5 breaths. Hopefully we'll see a change in the PI. That's the pulsatility index. We'll see that in a minute there. Oh, so many other questions. Good. I'm so happy, Nakia, that your grandma did better with the carotid endarterectomy. That's fantastic. All right. So like I said, a couple of those breaths, you can do it with me. And you're going to hear how much my heart changes. I'll bump up the volume one more time. And you'll also see, I'll bring this actually closer so you can better visualize exactly what my body is doing here. All right. 1, 2, 3. Does everyone hear what's happening with my heartbeat there? The variability changing? All right. So I'm going to bring this closer so you can see how I'm going to breathe in and out. And you're going to watch that up and down change. That's my heart. That's the blood going through my finger right now, right? And you're watching how I'm changing that with my breathing. And you can see the pulsatility index changing ever so slightly as I breathe. It's not as dramatic as going under general anesthesia, where I might go from 1 to 7, but I'm going from 1.5 to 1.7 while I'm awake, after 12 hours, so whatever, 17 hours now at work. Like, this is a, dehydrated, high-stress state. I can still make appreciable changes in the pulsatility index just from breathing. All right, hey, I hope you all learned something. I think the energy reserves are on low right now on my end, so I'm gonna peace out, try to get a little bit of sleep tonight. I hope everyone learned something, and just appreciate it, how much power you have over your body, whether it's through the blood vessels I showed you on the ultrasound, through changing your heart rate variability with your breathing, and how the pulsatility in your ear can be an indicator of how stressed you are, but more importantly, how you can change it with your mind alone. All right. And Nikia, thank you so much for answering those questions while I was busy trying to breathe here. Emily Jo is asking about orthos, and Ceph is great because it's bacteriostatic. That's why we like that more than clindamycin. Rebecca, I'm so glad. Thank you for volunteering. I'm sure the people that you cared for really appreciated it. All right. And Heidi, as always, thank you so much. Oh, Lisa is asking, how safe is anesthesia for someone with only 50% of lung function? Lisa, depends on what type of lung function we're measuring as 50%, but human beings can survive just fine with just one lung. So having 50% of your lungs, people can live very full lives and have safe anesthesia. So I'm going to say for the most part, if you had healthy lungs, removing a whole lung is okay. But there's other ways of measuring that percentage, and it really depends on what metric you're using. All right, any other last minute questions? And everyone, thank you so much for the kind comments. And healing, helping, loving can raise their heart rate if they wiggle their ears. I bet I can do the same. All right, let's end with this, guys. I'm going to wiggle my ears without moving my eyebrows and my... Let's see how much I can raise my heart rate by wiggling my ears. This is funny. No one's ever asked me to do this before. All right. Let's see what we can do. I'm wiggling my ears. Can you tell? My heart rate's staying in the 70s. I don't know. Don't think it worked very well for me. The next live stream, when will it be? I don't know yet. Hopefully next Monday. The next Monday. All right, everyone, have a good night. If you learned something, do please hit that like button, share with others. Your support helps me do this more often. From the San Francisco Bay Area, remember that you have more power over your health than you've probably ever been told.